happy to introduce our last presenter for today. Please join me in welcoming Jennifer Mitchell, who is the president for the Michigan Certification Board for Addiction Professionals. So we've heard a lot about different careers, psychology, social work, counseling. Jennifer is going to talk about the certifications that you can get in addition to those careers, and what's available to even high school students without having those extended graduate careers, so that you can begin your work in the mental health field. So Jennifer, thank you so much for coming on, and I'll pass it over to you.
Hi, Alicia. I'm so glad to be here. Is there a way that I'm able to share my screen, or is it already sharing?
Yes, you can share your screen. If you look on the bottom of your screen, there should be a little menu, and the third button from the left should be your share screen button.
Perfect. Okay. So I really appreciate the opportunity to join everyone today. I think this is a really important topic, and I wish that someone had shared this with me earlier on in my career, and maybe even when I was in high school. It would have been great to know, because I think a lot of us start out really passionate about helping people, and we want to find a way in our career to be able to help people, but we're not quite sure how to do that. And I am having trouble. It looks like it's just sharing the current screen. So I'm going to stop sharing there. I apologize for the technical difficulties.
You're all good.
Yeah, I'm just going to go ahead. And Alicia, if it's okay, I can share the PowerPoints with you and you can send those out.
Yeah,
I'd be happy to share those with you. Okay, so I'll be looking at my PowerPoints. Unfortunately, you won't be able to see them at the same time. But again, my name is Jennifer Mitchell, and I'm the Executive Director of the Michigan Certification Board for Addiction Professionals. And I was excited to talk today because I feel like high school students and early college students, this is a really important time to think about who you are. And you already have skills that matter. So if you're attending a behavioral health session, you already care about people, you want to make a difference. I would bet that you're a good listener, and you might be interested in mental health, justice, recovery, or community work. And if you're specifically interested in working in substance use disorder, one of the main requirements is to obtain a credential. And sometimes people will say, why do I need to do that? And the credential really proves that you have achieved a certain amount of work experience, that you have the education that's appropriate for your credential. And I heard one of the earlier speakers say that there are plenty of positions, excuse me, that are available without a degree, and that's true for us too. And I'll talk about those as I go through which ones you can obtain without a formal degree. There's also supervision that's required for credentials and a standardized exam. And then everyone needs to agree to follow a code of ethics. And because an individual has gone through this pretty rigorous process, it usually takes a couple of years to get through it. Employers know that that individual is really committed and dedicated to this field and has some skills that matter. And it makes you much more likely to be able to get a job. Even telling an employer that you're in the process of getting a credential can really make a difference to employers. So I said our long name, Michigan Certification Board for Addiction Professionals, but most people call us MCBAP. And so if you're doing a job interview and it's in a substance use space and you let them know that you're interested in achieving a MCBAP credential, that will be impressive to potential employers. And so we have a few different pathways. We have a counseling pathway, prevention, peer recovery, and criminal justice. Sometimes when people think of substance use disorder, working in the substance use disorder space, they think of counselors. And I'm a counselor myself. I'm a licensed professional counselor, and I'm also a CCS and a CAADC with MCBAP credentials. The CCS means I'm a certified clinical supervisor. The CAADC means I'm a certified advanced alcohol and drug counselor. And a lot of times that's what people think of first. So I'll talk about that first. So if you're a person who wants to meet with individuals one-on-one or work in groups with individuals, this might be for you. Most people who have one of these credentials work in a treatment center, a hospital, a community agency, that type of thing. And this is a good fit for people who like listening and want to help. And for a CAADC, you can have a GED or above. So we have individuals who have a CAADC, which is a certified alcohol and drug counselor, that have a GED, and we have people who have a CAADC who have a doctorate. So that pathway is very wide, and it really depends on what your career interests are. And what I love about our particular credentials is that it builds with you as you go through your career. For me, I started out with a CAADC when I was in the process of getting my bachelor's degree. And then once I finished my bachelor's degree and then went on to get my master's, I went on for the advanced addiction counselor credential. And so this really has built with me as I've gone through my career. And once I moved into more of an administrative or a supervisory responsibility, I went on to get my CCS, which is the Certified Clinical Supervisor. So this has built with me throughout my career. I have learned and grown throughout my career using this pathway. So let's say you're interested in prevention. You've probably, whether you know it or not, in your school have had prevention professionals come in and do various talks. They might have done education. They may have put on events, had collaborative work with the school and external agencies. You may not have even known they were prevention professionals. So there are sneaky little people there in the school system doing great work. And their credentials are called either a CPS, which is a certified prevention specialist, or a CPC, which is a certified prevention consultant. The difference between the two is the CPC has additional years of experience in education. So that is another way to grow throughout the career. To get the prevention specialist certificate, you do not have to have anything other than a GED or a high school diploma. I would say most people who have a CPS have a bachelor's degree, but we have a lot of people who have a high school diploma. And what the work looks like is exactly what I just talked about. A lot of times it's going into schools or community organizations or public health programs to teach people about how to prevent a problem before it even happens. And the prevention professionals like to say they want to put us treatment people out of business, and I want them to. So they're really working to find out what are the factors that lead someone to have a substance misuse or a substance use issue, and to try to prevent those before they become issues. So if you like to teach and educate, if you like supporting healthy choices, this might be a good career path for you. If you're someone who likes the idea and the challenge of preventing a problem before it even starts, and you enjoy working in coalitions and in collaboration and with youth, this is really a great pathway for you. Peer recovery prevention, or I'm sorry, peer recovery is another pathway that we have. And for us, that's called the Certified Peer Recovery Mentor, or the CPRM. And this is for individuals who are in recovery themselves. So you can become a CPRM if you're in recovery from your own substance use or misuse, or if you're in recovery from a mental health condition. And so this particular credential is a great fit for people who are in recovery and want to use the lessons that they've learned in their own recovery to help support other people. This is also a good credential for people who value connection and encouraging others, because that is what the work looks like. It's encouraging people in recovery or people who aren't yet in recovery and sharing with them what that might look like and giving them hope and supporting them through those early stages. And those individuals might work at treatment agencies. They may work in hospitals. I know several who work at emergency departments who go in and talk to individuals who are in the emergency room, maybe for the effects of a substance misuse or substance use. They also may work in outreach programs. So the work of the peer recovery mentors is so important, because actually a few years ago, President Biden was the first president ever to talk about peer recovery. And it was pretty exciting for those individuals who work in peer recovery to have their work acknowledged on a national platform in that way. And just really lifting up the value of people's lived experience. If you've gone through recovery yourself, you have so much to offer. And again, for a peer recovery, you don't have to have a degree necessarily. You can have a GED all the way up. And we do have individuals with GEDs, and we do have individuals that are peer recovery mentors who have doctorates and everything in between. It's a really diverse group of individuals. Another career pathway that we offer as part of our credential is the CCJP, and that's the Criminal Justice Professional in Michigan. And for criminal justice professionals, what that work looks like is that you're really encouraging people who are in the criminal justice system. So they could be on probation or parole, they could actually be in the jail system or the prison system, they could be part of treatment court. Anytime an individual's involved anywhere along that whole system, there's an opportunity for someone with a CCJPM to assist to them. So that work looks like supporting people that are involved in the justice system and connecting accountability with recovery. So saying this is something that's happened and it wasn't the outcome that you were hoping for, but understanding that everyone has the ability to change and really working with them to teach them about accountability and what kind of supports there are in the community to help them get on a more successful path. So individuals with a CCJP would encourage change, help individuals with stability and successful reentry back into communities. And individuals might work in courts in the probation or parole settings or reentry programs. I'm not sure if you're familiar with treatment court, but they're called by many names. Some of them are called drug courts, some of them are called sobriety courts, some of them are called just treatment courts. So there are a lot of names for them, but they all essentially are supporting people specifically with a substance use disorder to take back their lives and become a really model citizen. And those programs have been highly successful. People with a CCJPM might also work in a treatment program that supports those who are criminally involved. And that's a good fit for people who are interested in criminal justice. And so if you're somebody who thought I might want to be a police officer or I'm interested in getting a degree in criminal justice, this is something you might want to consider because it's a good fit for people who have that interest, because substance use disorder really impacts individuals in the criminal system. So it's important that people who are working in that space have specialized knowledge and understanding in substance use so that they're not reinforcing stigmas and that kind of thing, but they're really helping people to understand what supports they need um, to have a life that is one not involved with the criminal justice system. And so it's a good fit for people who care about fairness, recovery, and second chances. And so, right now, what you could do if you're interested in substance use disorders is to take classes. So, if you're planning on going to college, take classes in substance use and decide, is that something that's interesting to you? You might think it's interesting because you have family or friends that have had a substance use issue. You may take the class, learn a lot, decrease the stigmas you might have yourself, but then you may decide that you don't want to work in this field. That's great. You still have gained really important knowledge that will help you in whatever career you go toward. But if you do take the course and you love it, like I did, and you decide that this is where you want to work, and this is the kind of work that you want to do, that education can later be used toward your credential. I apologize. I don't know why I have a little cough this afternoon. Another way that you can get involved is to do volunteer or community service right now. So reach out to treatment centers or any of the places that you might be interested in working and ask them what ways that you can be involved in the community, how you can learn more, if there's any volunteer things that you can do in order to support them, if you can help them get the word out. Agencies are very impressed by that, and it's unusual that someone would take that initiative. So they definitely would be interested in hearing from you and impressed with you for taking that kind of an initiative. Another thing that you can do is to follow us, McBAP, on social media so that you can continue to learn along the way. So we're doing posts and updates, giving little details about individuals who work in the substance use disorder space. I meant to say earlier, you saw a smiling picture of a person, and that's one of our credentialed individuals. And we do that a lot on the McBAP social media, is that we really like to highlight our professionals. And I think if you're in high school and you're reading some of those things, you can decide, do I relate to these individuals? Are these people I would like to be like? Is this something aspirational for me that I'd be interested in learning more about? And so just following on social media is a really easy way to gather more information, find out what kinds of activities are going on in the community, what colleges you might want to go to that are especially targeted toward substance use disorders. So, anytime that you want to follow any agency that you might be interested in working with in the future, it's a great thing to follow them on social media because you already have a relationship with them. Once you actually go ahead and apply for a job, you can go in and talk to them with confidence and you can say, I've been following you for years on social media and I've been really impressed with, and then you'd be able to describe what kinds of things you've seen them do. And again, that's the kind of initiative that a lot of employers don't see that would really set you apart from others. So, were there any particular questions that popped up?
I don't see anything in the chat, but I do have a question on behalf of the students. So if I am a high school student, I've started this course, I took it, and just like you, I loved it. What is my next step? I decide, maybe I'm going to school to do post-secondary, maybe I'm not, but I definitely want to get this certificate, whichever ones are available for, that entry level GED level. What would I do?
So the first thing is to go, everybody's going to say this, to the website, right? Like that's where we all start. So if you're interested in the credential, you can go to MCBAP.com. You're not surprised by that as our name. So it's M as in Michigan, Certification Board for Addiction Professionals, MCBAP.com. And in there's a document called MCBAP Credential Requirements. And you can look at that to see what we require, because you'll find out, I mentioned earlier, potentially doing volunteer work. That's something that can count toward your credential. And a lot of people don't realize that. They think it has to be paid. And so those are things, if you look at it now, you can go ahead and start doing, building your basket, putting little things in your basket that you're going to use toward your full credential. Because when people hear me say it'll take a year or two to get your credential, they get like, a little disappointed that it will take so long. But it's so surprising how those little things, volunteering here and there, build up your work experience hours. And taking a class, like you said, it doesn't have to be in college. There are lots of classes on substance use disorder in the community. Make sure you save all of those pieces of paper, those certificates they give you, because those are going to count toward your credential. And we go back up to 10 years. So if you think you're ever interested in getting a credential, start pulling together your materials now. It's not too early. Might feel too early, but it isn't too early. So start putting that together. And I heard someone on the earlier session, I snuck in a little bit earlier, saying, call and talk to people who work in treatment. We love to talk about what we do. And I always told people when I hired them, within the first year whether or not this is the right fit for you. You really do. You either fall in love with it or it's not for you. I thought when I graduated with my bachelor's, I wanted to work in domestic violence. I was sure that's exactly what I wanted to do. But I could only get a part-time job in domestic violence. And I was like, okay, I have to get another job. And I got a part-time job in substance use disorder. Totally fell in love with working in substance use disorder, fit like a glove, and then went on. But everything that I learned in domestic violence was helpful for me in working in substance use. There's not any education that's wasted. So go to everything you can. So if there are free seminars like this, if there are free seminars, if there's anything like this that you can participate in, soak it all up and see what sounds like a good fit. You might not, someone listening to this might not have even realized what those people in their school were and their prevention specialists. They might not have known that, but they might have had a little thought like, that looks fun. I'd like to do that. So just observe and take it all in.
No, that's perfect. And I'll give you the opportunity to share any last pieces of advice. You already kind of landed on a beautiful final statement, but is there anything else that you'd like to share with the students before remarks?
We need you. There is a huge need in Michigan for people who are passionate about any type of behavioral health, particularly substance use disorder. So if this is work that sounds good to you, if you feel called to do it, there's a huge need for you. And so there's definitely a lot of job security in working in this kind of field, and you are definitely needed. So if you have that passion to help people, there's definitely a need for that in our community. And I just appreciate people being willing to listen and learn more about it. So thank you, Alicia. I appreciate you inviting me to join today.